Hi, my name is Rachel LeBlanc, and today I will be talking to you about Do Not Resuscitate Orders, also known as a DNR. A DNR is a more specific type of living will. This is also known as a medical or physician's directive. It encompasses the desire of the patient in certain scenarios. An example of this would be if they would want CPR should cardiac arrest occur. If they have a DNR in place, then they will not get CPR. When properly executed, it gives physicians immunity from the claims of negligence or wrongdoing in a patient's death. Nurses also have a duty to respect the patient's wishes in these cases. The picture is an example of what a DNR form looks like. The history of DNRs. DNRs were first described in the early 1970s. By 1974, the AMA proposed that DNRs should be documented in the patient's medical record and be communicated to other staff members who will also care for this patient. This protocol has been shown that when documentation isn't properly reported, patients can risk receiving unwanted CPR. There are many problems to DNR orders. These orders can be unclear and the documentation on a DNR can be inconsistent. A DNR doesn't mean that the patient and our family have been fully informed on its meaning, and they can be confused on what it actually means. According to Cherry and Jacob, 3 problems may arise regarding a DNR order. A physician refuses to comply with patient's wishes and initiates CPR. The patient revokes consent to DNR order. A family member demands the DNR order to be rescinded despite the patient's continued objection to CPR. Should any of these 3 situations occur, the nurse must act quickly to involve the nurse supervisor and/or administration. Nurses' roles in a DNR order. Nurses spend the most time with the patient, providing bedside nursing and medical care throughout the day, and are often the ones who initiate the DNR discussion, even though physicians are the one who makes the decision. There has also been expressed need for clear and well-documented DNR orders and informed patient and relatives by nurses. This will help them provide good nursing care. For example, extra support to the families, helping the patient to a peaceful death, and avoiding unwanted CPR. Nurses are lawfully expected to execute a DNR order. If these are not followed exactly, nurses can be sued for failure to observe DNR orders. Claims include battery, negligent infliction of pain and suffering, and wrongful life. There have been several barriers noted to making a clear DNR decision. Some of these barriers are to not cause worry in the patient, not to take away the patient's hope, lack of physician experience and feeling of discomfort, timing of the discussion, and risk of making the wrong decision. Making a DNR decision is a big ethical decision. It can be difficult and possibly cause conflict of interest between the patient, family, and the interprofessional team. An example would be disagreement between the interprofessional team if the patient should have a DNR or not, and if the patient and our relatives should be informed or not. It has also been reported by doctors that they experience ethical conflicts when regulations require information to patients about a DNR decision, but they consider it being against the patient's best interest. This is a complicated process involving nurses and physicians with different experiences and perspectives. Results of my evidence-based practice article. This article looked at a survey of nurses and physicians in hematology and oncology on a DNR decision process. The research concluded that nurses and physicians need to talk openly about their different perspectives on DNR decisions. It should also be known to them that what they think is important is not always likely to happen. This is particularly important for nurses because physicians are the decision makers, and this will help them avoid moral distress by knowing the reasons for a DNR/CPR decision. Essentials of baccalaureate education for professional nursing practice related to DNRs. The most important part that applies to the DNR order is effective communication and collaboration among health professionals. To deliver high quality and safe patient care, you need to have teamwork between healthcare professionals. Collaboration is based on complementaries of roles and the understanding of these roles by the members of the healthcare team. Cues and competencies related to DNRs. The competencies that relate to a DNR is patient-centered care, teamwork and collaboration, evidence-based practice, and safety. The one that applies the most is patient-centered care. This is shown by giving the patient and family what they want. The next biggest one is teamwork and collaboration. Nurses and physicians have to work together to help make the decision if they need to approach family about this and then need to work together to provide the information to family and patients. Next would be evidence-based practice. This is useful in knowing if the situation even warrants a DNR. Lastly is safety. This applies by protecting the nurses and physicians and doctors from repercussions of not performing CPR on a patient who died. This is my reference page. Thank you for watching.